People, pet owners, and veterinarians are using softpaws instead of declawing. And how you put softpaws on is you take the tips off the nails first with a nail trimmer, and we use a guillotine type of trimmer. And then after you get all the nails trimmed, just the tips, then you can take the softpaws and you use a little bit of glue, and you put the glue in the cap of the softpaw, and then you fit the plastic covering over the nail up close to the nail bed. And you can see we actually scruff the cat, pinch its neck while we're doing that, because this is a little kitten and it doesn't want to have anything to do with anything that we're doing. It probably thinks what we're doing is ridiculous and can't understand it, and they just don't like to be restrained and manipulated. But anyway, you can see the nails are the pretty blue nails, shiny, and they fit right in with all today's pretty nail treatments, are fit onto the nails, and they prevent the kitten from shredding furniture. And if you are an immune compromised person, it may prevent you from getting wounds. And you can see the tube there is a crazy glue type material, and that's what we put in the caps, and then that grips the nail. So you fill up the bottom of the cap with the crazy glue, and then you put the cap on the trim nail, and you hold it there for a few seconds, put it up where it's snug, and then it'll stay on for a period of time. Remember that cats will wear them out and they shed their nails, so you have to watch and see how long your cat will wear the soft paws. People are using this instead of declawing these days because it's much more humane for our little pretty kitties. Look at this little kitty. It's in a zone because the scruffing of the neck releases endorphins in its body like a morphine drug that we call a runner's high, and it kind of is just hanging, and it's not really that uncomfortable, but and it kind of puts it in a little zone, but it really helps us do our job, and you can see how pretty the nails look afterwards. So here's the last few, just a close-up of putting one on. You can see how she holds it on there, and it could be a two-person job. I mean, your cat might let you just put it on. Might let you trim the nails and just put them right on there. Each cat's a little different. And here's what it looks like afterwards. You can see how good the nails look. What do we look for when we examine little kitties when they come in for vaccines? Well, we look in their ears to make sure their ears are nice and clean, and we look over their general body to make sure they're nice and healthy. Look in their mouth. Say, God, the gums look nice and pink, and the teeth are all lined up in the right places, and the glands underneath the throat aren't too big like they have an infection, and there's no eye discharge or nose discharge like they have a respiratory infection, because if they did, we couldn't vaccinate them. And then when we look at their little behind to make sure they don't have tapeworm segments, and this little kitty has a cutest little rear end with a smile on it. Well, it's just the way it's pigmented. We check its internal organs to make sure they're all the right kinds. The kidneys are there, the liver's there, the spleen feels normal, and the bladder's not too big, and the colon's not too big, because they can have genetic defects. So we want to make sure the kitty's just fine with all of its organs and everything, and doesn't have a respiratory infection, so if we vaccinate it, it doesn't get worse. And then we check its heart and make sure that beats there. Beat to beat to beat to beat. Make sure the rhythm's really good. Now, why I'm not using my voiceover is because my staff was so rude in talking during this exam, so I have to voice over this part. Anyway, this kitty's in good shape, so we're going to give it a vaccine, and we're going to use 2 vaccines. We normally give 3. One's for respiratory viruses, one's for feline leukemia, and then the other one is for rabies. And this kitty's old enough to get its rabies shot. It's already had its respiratory viruses, and so it's already had its leukemia, so we're going to give it a respiratory virus shot, and we're going to give it the rabies shot. And it's so good with all these shots. But when I started to give the next shot, it kind of looked back at me like, No, you're not going to do that twice to me. So I had to give it a little break as I was talking, and then I started to put the shot into it, back in the back hind area where we normally give it. The kitty goes, no, that's not going to work for me. So then what I did is I went ahead and gave it up a little forward around the neck where it's not near as painful. So then the kitty just says, okay, well, you can do that. You can give me a shot there, and that'll work for me. So that's what I did. I gave the shot right in the back of its neck. And then this little kitty's so cute, it likes to ride on my shoulders. You'll see it in a minute. First, I have to say hello and goodbye. Hello, audience. Goodbye, audience. And then I'm going to put it on my neck, and it's going to ride back to see its owner. So we're going through the hospital. The cat's riding like a true little cow cat, cowboy, cowgirl, and then we go back in the room. Well, I hope you enjoyed the demonstration of the soft paws and the vaccinations. Have a great day.